He feel like the prison system really don't care.
The Indiana Department of Correction is still dealing with a Legionnaires' outbreak at the Pendleton Correctional Facility in Madison County. There have been more cases reported since the outbreak started earlier this month. That outbreak has killed one inmate already. CBS 4's Eric Graves joins us now in the newsroom with the concerns of family and friends. Eric.
Bob, since we last told you about the outbreak at Pendleton, there are now 2 more cases of Legionnaire's disease. One inmate is in the hospital. Family and friends of those living the facility say they want to know what's going to be done to fix this long term.
Everyone is living in fear.
And they're still human beings.
CBS 4 spoke with 3 people who all have a friend or family member inside of Pendleton Correctional.
He's concerned because he doesn't think anybody cares.
Legionnaires is a very serious form of pneumonia that can spread through hot mist from contaminated water. The outbreak started around the beginning of this month. Since then, there have been 7 confirmed or probable cases of Legionnaires. 1 inmate has died and another is in the hospital. Mary Connor's friend is inside Pendleton. She says he's worried.
The last few times I've talked to him, he just kind of sounds like despair, like, I give up.
Another woman we talked to, who asked to remain anonymous, has a relative inside of Pendleton. She says the inmates in there aren't being told much about the outbreak, so they're more fearful.
When they ask about it, they're telling them that that they are working to get it under control.
A spokesperson for the Indiana Department of Correction tells us inmates have been provided fact sheets giving info on how Legionella spreads and what is being done to fix the issue. Devonna Green, another person with a friend inside Pendleton, says her friend is worried the issue won't be solved.
He feel like that no one is never going to do anything.
The IDOC says it's working on a long-term plan for how to get rid of the bacteria, and in the meantime have added filters to showers where they have detected Legionella. Still, we're told some inmates are uncertain of the water they're showering with.
He's really scared of when he takes a shower because, of course, you're breathing the hot water spores in from the shower.
All 3 people we talked to say they want IDOC to find a solution before anyone else is affected by this virus.
If he was to die, I would be devastated. I would literally be devastated.
We were told IDOC is not allowed to share the condition of the one person in the hospital with Legionnaires, but he has been there for a week now. No timetable also on the plan to be finalized to fix the problem long term. We're told that it will involve disinfecting treatment of the water and ongoing testing. IDOC did say no one would be available when we asked for an interview earlier today. In the newsroom, Eric Graves, CBS 4 News.